Hello, everybody, and thanks for joining us for the second part of the Diversion Reimagined series. As Brian said, I'm John Cookus, a consultant with the Annie E. Casey Foundation and primarily working within the probation transformation world of the foundation. And once again, so glad you're joining us. One bit of a change, Opal West, there was a last-minute change. She asked me to moderate the panel and provide some questions to each of our panelists. So if you don't see her, I know she's listening in, but we wish Opal West a great day today. Everything's fine, but last-minute change. So let me begin by announcing and introducing you to our panelists, and I'm very grateful that they are participating today. And what I'd like to do is introduce you first to Kevin Bethel. Kevin has been most recently appointed the Special Advisor and Chief of School Safety for the School District of Philadelphia. Kevin is a retired Deputy Police Commissioner in the Philadelphia Police Department, the fourth largest police department in the country. Throughout his career, Kevin has done extensive work in the juvenile justice field, most notably the development of a school diversion program within the Philadelphia school system that I know he talked about last week. Next is Jessica Ellis. Jessica serves as the Executive Director of Sentinella Youth Services and the Everyday Restorative Justice Center in Los Angeles, California. Her organization strives to end the school-to-prison pipeline and the over-incarceration of youth. Jessica has 26 years of experience in youth development, education, nonprofit management, and restorative justice. She has received awards for her visionary leadership in building the second largest restorative justice program in the country. She is driven to ensure that victims and families touched by the justice system involve reconciliation and healing human connections. Next, we have Dr. Bernard Williams. Dr. Williams is currently the Chief Probation Officer Administrator of the Juvenile Court of Memphis in Shelby County. Bernard is a native of Memphis, Tennessee. He has worked in residential treatment, community mental health organizations, mentoring programs in schools. He has worked on various committees and programs, including the Trauma Workforce Group, local and statewide DMC Task Force, and served as the Racial and Ethnic Disparities Committee Chair. He also serves as a deacon and minister at his church, and he has earned a PhD in psychology. So thank you very much to our panelists participating today. And what I'd like to do is just get right into it. So let's do that. If you do have any questions that you'd like us to address, please use the chat session on your screen, and we'll do our best to either have our panelists answer at that moment or reserve time at the end of the session. So let me start with Kevin Bethel. Kevin, everyone talks, and I know there's information out there about different programs, and I know we're talking about diversion today, and very often as the professionals on this phone, when you attend workshops, you listen and you hear great ideas, and it's always sometimes a little intimidating to think about, all right, what can I do as the participant? What are the first steps that I should be thinking about when I leave this workshop? What are those initial things when I walk out this door that I could be working on? And I'm going to throw this question out to each of our panelists. So let me throw this out to you, Kevin. What are the first steps that you would recommend or suggest to those participating today that they can do right now to divert more kids from the juvenile justice system?
I think, and John, thank you for the opening and the welcome. I think the first key thing is the data. You know, I think all too often we make the mistake of working off of anecdotal stories and what we think is happening in the system. And so a big part of really coming out the block is identifying what is the real issue. I mean, what are we looking at? What are we arresting? What is being put into the system? Really kind of sets the framework for where you can move forward, particularly if you're trying to address the issue around disparities and where those disparities may be existing. And so I think that's a key component, because when I started out, having that data as the bedrock of the work I would do when folks would stand up in the meeting and throw out these anecdotal stories that make absolutely no sense, I was able to refute oftentimes those comments by just turning to the data and say, hey, you know what, my small school was worse than my big school, even though the per capita, but when you did the per capita numbers, it was much, much worse. I think the second part of that is really convening the right people and having the right people in the room. If you're just going to have folks who really, and listen, I appreciate there's so many people who want to engage in this conversation, but oftentimes they come to this table with really no authority to make any demonstrative change. So if you're going to divert and you don't have the police officer at the table or the police chief at the table, well then, if you bring me in, on the final, after 5 weeks of 8 weeks of meeting, and now you bring me into a room, really is not going to get me, buying into this process. So I think it's important to convening the right folks in the room and bringing those decision makers in the room who can really, really identify what your needs are, and how I can support you in that process. So I think that's very, very critical. And I think the final area is really looking, part of what I often tell folks to go back and do and just look at their policies. So much of the stuff that we are doing, even I identified in our work, was just a failure of really evaluating who put this policy in place. Who said that I had to arrest a kid coming to school with a pair of scissors? Nothing really said that. We are the state law said that the school would notify me, but there was absolutely no written policy that said I had to lock up a child for any of that behavior. But we somehow filled that gap in. So sometimes it's also just taking a hard look at what are some of the policy decisions we've made that have driven us into this place where we're arresting kids when it's not someone else. Somebody say they or somebody. I'm like, who is they and who is somebody? Sometimes it's you. But if you look at your data and you look at your policies and you start to realize, oh, I own that. That's where I would come to realize I allow policies to be in my space that allow kids to get locked up. And if I took it off, I could drop 71% in school arrests just by Kevin Bethel, Deputy Commissioner of the Police Department, say that's not my policy anymore. And so I think sometimes you have to re-empower yourself to understand that you have the controls and you can do something different. So that's kind of three areas I would hit, John.
Okay. Thanks, Kevin. Jessica, Bernard?
Yeah, I would, first of all, Kevin is spot on. I would echo all of that. So just kind of building from there, data was also very helpful for us. We asked our prosecutor's office to look at their data on kids that they were adjudicating in court, and 2/3 of the kids on their court caseload had been adjudicated previously. And that helped our prosecutor see, oh, well, maybe this, adjudication isn't making the behavior stop, so maybe there's something else that we can try. And from there, with, again, the right decision makers in the room, as Kevin already explained, which in our case was the presiding judge of juvenile court, the prosecutor's office, the public defender's office, probation, some local community-based partners that would be working with us, as well as our Department of Children and Family Services and children's rights advocates, some legal firms that do a lot of work around equity and children's rights. And through that process, we worked towards shared goals. So while there were quite a wide range of ideological perspectives in the room coming from really different angles, we focused on where we have agreement. So, for example, on reducing crime and victimization and reducing that recidivism, while we all had some different ideas of how we would get there, we could agree that those were the goals, and if the data showed that this was working, then we would be on track. So, and then we also agreed on meaningful accountability, that this wasn't just rehabilitation, but with the restorative justice piece, the idea of meaningful accountability, not just punitive consequences, which are disconnected for teenagers, but really making that connection of making things right to the person who was harmed was something we could all get on board with, regardless of our political orientations, et cetera. And then also not just starting with first offenses and low-level misdemeanors. We came out the gate with felonies included, several felonies included, as well as second-time offenses included if the kid had not had a previous opportunity for meaningful diversion and youth development interventions. So that we didn't have to, it's harder to kind of ramp it up later if you start so low on the pole of intervention. So we really started out higher, and then it was easier to kind of continue to expand from there to youth who are gang involved and, you know, felonies with injuries, that sort of thing. Thanks.
Okay. Bernard, is there anything you'd like to add?
Yeah, sure. I believe one of the key components that you have to always realize is, you know, we've talked about leadership, but when you talk about leadership, you have to go into the room prepared. You know, I've seen meetings where people come in and you want to make a change, but you go in and you just really are just talking. But when you go in, as Kevin indicated, with the data, and you can really help individuals in the room make an informed decision based upon the data. So when you go in, you want to make sure that you identify how many kids are in your detention facility that have low-level offenses, how long they've been there, the length of stay of those kids been in those detention centers. So when you go in prepared. But then just don't go in prepared to share the problem. You want to go in and also have an idea of what other jurisdictions are doing around the country that are being successful with diversion. So go in with the problem, but now you're going in with the solution as well. And when you go in with that type of approach, you then start seeing the light bulb go off with a lot of leaders in the room. I've seen that happen, especially when you start identifying these things and building that cross-system collaboration. And I always, you know, leaders, I would say start small. You know, we started with one police precinct and we tried it, you know, and when you start small, you can just say, hey, can we just pilot it for 6 months? And at that point, leaders are more saying, okay, let's try it. Instead of trying to, you never want to go in the room wanting to point fingers as well. You know, you want to go in as a way of saying, let's do this together. And when you go in with the prosecutors, you go in with defense attorneys, the judge, and the community as a whole, I believe you'll get more buy-in.
Okay. Thank you, Dr. Williams. What I'd like to do is switch gears a little bit on a specific question. I think we received this via the chat session during the last session of Diversion Reimagine. And I know that Jessica alluded to equity a little bit during her response during this session. But during the last session, she had talked a lot, or at least a little, but not enough that some folks wanted a little more, about the equity protections that Centinela Youth Services has in place. And I'd like to get a little bit more detail from you, Jessica, if that's okay. If you can tell us a little bit more about that.
Sure. It starts with the referral criteria and how we train our law enforcement officers to assess if a young person can qualify for diversion. And we do a lot of training up front for their buy-in, and we train on the teen brain and why kids do what they do and how trauma affects behavior, why diversion is effective, how the services that we're using are built around what works for the teen brain, and what is restorative justice and how it brings meaningful accountability. So we first did a lot of work on buy-in and trust building and all of that. And then we focus on the referral criteria, which is, for us, it's the factors that they're using to determine if the young person can go to diversion are age, priors, and crime type. It's the specific penal code that they pick the kid up for qualified. And we stress to not make the decision based on anything other than those facts on paper. So in our law enforcement partnerships, command staff are starting to take away some of the discretion of officers, in the sense that the child's attitude with the officer should not bear on whether or not the kid gets the opportunity for diversion. We have found that there's no correlation between the child's attitude with the officer and how well they do with us. So, but that can be hard when you have a kid who's mouthing off at you or resisting arrest. It can be hard to get the buy-in to still divert in those cases. The other piece that we've had to really train our partners out of is considering the family dynamics or their own interpretation of the quality of the family. That is also where major equity issues can come into play. So it used to be a lot of our officers would say, well, I sent you this kid because the family, it looks like a good family, and we'll know they make sure they participate. No. That is really where we start seeing discrimination. So a lot of families, we've been able to do a lot of work with kids that have wide varieties of family engagement, and there's different methods that we use, and the child should not be penalized based on some impression of the family. Then a second piece is because we work to build buy-in all the way from the frontline officer level through detectives, sergeants, lieutenants, all the way up through command staff, and we keep open lines of communication. We have received referrals where there's a clear civil rights violation or even some blatant racism going on within the arrest or the referral process or during the incident of some sort. And because we've opened up those lines of communication and trust, we don't go off to the paper with those circumstances. We go to command staff, address it appropriately, let that inform further training for their team, and we will push back on diversions. If the young person shouldn't have been arrested in the first place, we're not going to just put them through diversion with the excuse of, well, it doesn't go on their record anyway. If that was a wrongful detention in the first place, then we need to talk about that. And so our law enforcement partners, because we come at it without blame, but just let's look at this and let's see what's fair, we've had a lot of success in having cases dropped that really shouldn't have come to law enforcement attention or shouldn't have been pushed through to diversion in the first place.
And I know I've mentioned this experience before. Dick Mendel, our primary writer or one of the primary writers at the Casey Foundation, and I traveled to Los Angeles last year. We met Jessica during the month of January, and we had met with members of the Los Angeles Police Department. And I do remember one of those members saying to me that they no longer promote their police officers because of the number of arrests, but they promote their officers by the number of diverted kids that they make as well. And I found myself having to stop, and I think I asked the officer in charge to repeat it just to make sure that I got that. And Jessica, I want to throw something back at you again. And I know you talked about those protections and working with law enforcement and, diversion in the community-based model, community-based organization model. What kind of pushback did you get from members of the community, law enforcement, and maybe some others when you had begun your charge or this process?
Well, it's not just at the beginning. It's a continual process of buy-in. Folks come in new. You're dealing with new rookie staff who've never heard of this before. So it's a constant dance of building and rebuilding buy-in over and over and over again, as we've been doing this for over 30 years. And so I think the common concerns right out the gate are there's often a distrust between law enforcement and community. So there's an idea from law enforcement that community just wants to let kids off the hook no matter what, and that we're going to hide kids from them or not let them know if the child is still being a danger to the community. So there's a real concern that community isn't going to care about public safety. And vice versa, we're all familiar with the concerns from community with law enforcement in return. So one of the things that we focus on is we're mandated reporters. So if someone that we're working with is a danger to others, we have to report that. And also we work with the crime victims, the harmed parties, as well as the young people. So we're really looking at the whole complete picture. How do we keep as many kids out of the system as possible while maintaining public safety and making sure that folks are not being harmed by that? And also as social workers, we we don't believe in enabling either. So we talk a lot about that and how do you actually make sure that you're helping a young person grow and evolve and meet their full potential and not just be enabling bad behavior over and over again. So we talk a lot about how we are on the same page with that, and it's a constant reintroduction, re-buy-in on those issues. There's also a lot of perception amongst our newer referral partners that poor behavior from teenagers comes from bad parenting. That is not what we experience. The vast majority of the kids that come through our doors have great parents who care a lot about them. And teenagers just do dumb, risky things. It's part of the teen development process. And on top of that, we have a lot of families who are working multiple jobs, and so there's less supervision in the home due to economic factors. That's not bad parenting. So being able to talk through where these things really come from and push back against stereotypes and misunderstandings of where the behavior comes from then builds empathy, and then that empathy leads to more referrals. And then as the kids are successful, then we earn that trust, and then we're in a cycle of moving on from there.
Thank you, Jessica. I'm going to shift gears once again, and this question is kind of two parts. So I'll throw it out to Bernard, Kevin, and Jessica, and whoever wants to take it. So often when we try something new or different, there's always the question about, well, and I think Bernard alluded to it a little bit, and I love the way you suggested that, Dr. Williams, where you talked about, let's just try it, right? Let's just try it. And I really love that concept, actually. But whenever you try something new, there's always that discussion with leadership and policymakers, and of course those that are part of the call. I'm sure we have many policymakers and those of leadership on the call or on the webinar. But whenever we talk about something new, the question remains, well, how are we going to pay for it? And because we're shifting services away from the court and kids and families need those services in the community, two parts. How do we begin to engage the community-based organizations and say, okay, what do you need? And then how do you find resources for kids and families for those services in the community? What are some of the strategies or maybe some of the processes that you had to go through to figure that out?
I guess I'll kick it off. How do you engage community-based organizations? I would say, number one, you want to identify common problems that you're seeing in your community. We've noticed that from the inner city all the way to the suburbs, in every part of our city, we're having youth with a majority of problems dealing with drugs. We've got problems with theft. We got problems with robberies. We got problems with rapes. We got so many problems. But there's a lot of organizations that are in our communities that are really, you won't see them like St. Jude. St. Jude is in Memphis. You won't see them on a commercial. There's some hidden gems in our cities that we really have to look at. One of the things that we did was we connected with the University of Memphis and their Department of Social Work. They had, people who looked for us in the community to find what was in each resource, which was in each zip code. So we developed a zip code based resource directory. I believe it opened all of our eyes to see what resources that were already established in our community. And at that point, we know what's out there. And the next thing we can do is bring those individuals together and discuss a plan of action so that we can better advance our youth away from the justice system. You'd be surprised that a majority of our judges, they'll say, well, we don't have any programs to send them. But when you actually identify what programs that are out there, that are willing to work with our youth. And some of them already have funding. I know we talk about, funding, but a lot of people, they already have funding. Maybe it'd be a church, maybe it's an after school program, and it's at some community centers. And we utilize those things that are already established.
So, hey, John, I don't know if I pick up on there, but in our situation, I was fortunate that our Department of Human Services that does our juvenile justice, supports the juvenile justice system, has a community-based model already. So we have community-based, so we use 6 programs. And one of the things I also always realize is that these things that are rooted in grants and when the funding goes, the program goes. And oftentimes we wonder why the community doesn't trust us. Is because you come in for a year, you do all this grandiose things, and then when the money runs out, we shutter the building and we walk away. And so I recognize that whatever we're going to do had to be sustainable throughout the existing budget. So I was fortunate enough to be able to work, because of our JDI collaborative and work at the executive level of the Department of Human Services to kind of build in as we were moving forward, keeping them abreast. So I would forecast how many kids I project I'm going to bring into the program next year as I expand it. I project there's going to be another 300, so that as they were doing their budget-based, programming and looking at their budget, they could factor in, hey, guess what, Kevin's going to have 300 more kids coming through the process. So really working with those. It's hard to come to somebody in May when and the contract's been already reconciled and say, hey, guess what, I need to put in the next budget and have $1 million for kids. So you really laying out what your needs are to folks who can support you. So when they are making their budgets, they can factor in, hey, guess what, Kevin's going to launch a program. He's going to need 200 kids. Can we put that into our budget? And I think wrapping around to my earlier conversation about policy, we also have to recognize that many of these community-based groups are not evidence-based. They don't have all of the sexy tools that everybody, so when they come to apply for these grants, oftentimes they're rejected because they can't get whether the insurance to go with it. So we also have to take a hard look at it. One thing to come into community and ask them to be a part of your programming. It's another thing that sometimes they often need, some of your best ones need support. They just can't walk in and fill out a 10-page application that tells them they have to have $2 million in liability and believe that they can walk away. And so what they do, some of my more effective groups get the crumbs because it's just a big organizations that could come in and be able to do that. So I think we also have to be conscious of when we're looking across what we need, what are our policies that keep them out? When we talk about equity, what are the policies that keep out some of your hard-working groups that are out there who just really can't get any funding going because they don't meet the threshold of so as soon as you put evidence-based down on the sheet, okay, they're out, and many of them are so effective because they come from the community, know the kids, the people trust them. They often can be very, very effective in doing the work.
Thanks, Kevin. Jessica, I think I'm trying to read your body language. I think you wanted to say something. And I'm just wondering too, Jessica, for as much as you can talk about, I know out in Los Angeles when we were there, I know there is a particular group that provides, I think $5,000 or something each, 200-member group, and there's seed money for a particular program every year. It was one idea that I wasn't aware of. And if you could just kind of roll that into your response and how they do that, just as an idea, I think that would be great.
Yeah, the group you're referring to is basically a giving circle that it's a group of 250 women who pool their funding to come up with $1 million, and they give a $1 million grant to a youth service organization in the LA or Southern California area per year for a dream project. So unfortunately, because it's a one-time only grant, it's not really a reliable source of funds for this. However, they have been instrumental in seeding some big projects and work in our area that helped launch and build some capacity with nonprofits to be able to take more of this. So they provided some funding for us one year, $1 million, and then they also, through another local family serving mental health clinic and a gang intervention program this year to meet their dream projects. But the bigger piece for us for funding has been in California, we have some modest court fees for every court filing, and that goes into a pool of funding called the Dispute Resolution Program, which provides funding for programming that provides conflict resolution to keep matters out of the court system that was created when our courts were overloaded. So that's been a constant source of funding for our program, as well as federal dollars through Juvenile Justice Crime Prevention Act, Title II. Those are funds that come through states and then off to local jurisdictions that are aimed at youth crime prevention. Also, we've seen other jurisdictions use some of their community-oriented policing funds for this, philanthropy. And, you know, as Kevin mentioned, sometimes with government entities can kind of pop in and fund something for a little while, and then the politics shifts and they move on to something else, which again, as Kevin mentioned, can create some trust issues in the community. So also identifying community-based partners for whom this is their long-term mission. They're not going anywhere. So that's been us. We have taken charge of funding our own programming for the last 35 years in diversion. That's our focus. That's what we're going to do. So we chase down state dollars, county dollars, philanthropy dollars to make sure that we can continue to provide our services. We need support from our local jurisdiction, and so whenever the political winds move and we can get that, that's really important, and we can serve more kids. So you can fund your partners that are doing this, but also make sure that you're investing in the long-term sustainability of that work. And so there's a big push in our community now to seed more sustainability amongst other community-based organizations, and really a big push to move not just with diversion. Diversion is once a kid's already in trouble. There's some damage already been done. So we're, us and other local advocates in our community are pushing hard for front-end investment on positive youth development work up front, so our kids we're investing in our kids the way they deserve to be invested in, so that they can be successful, so that we're not having to worry about diversion. The real goal would be to put most diversion out of business, that most kids don't come in contact with law enforcement because they're getting this appropriate supports and interventions for trauma and other health needs, family needs early before it gets to this point. So we really do advocate for as much front-end investment as possible in kids.
Okay, thank you. I know each of you have mentioned a couple times law enforcement, and I know because of Kevin's background in Philadelphia, he certainly brings a tremendous experience. And he's shared this story a couple times that I've known him and I've seen him present, and he alluded to it the last session on the Diversion Reimagined series. And what I'd like to do, Kevin, if you don't mind taking this question, is we've been talking about pre-adjudication diversion and pre-referral to the court diversion, and you didn't start doing diversion when you first hit the street as a police officer. It took a while for you to see things, experience things, and decided, you know what, we got to change the way we're doing it. And I'm going to throw this out to you, and it's, all right, knowing that law enforcement in that process, when you make an arrest, that's really, you're at the gate there for the juvenile court. And law enforcement are so important and part of the process to help us divert kids. How do we change that process from arresting kids to referral and instead divert them and working with police and or community-based organizations? I throw that out only because I've heard you talk about that experience, and I think it's important for this group to hear how you changed personally and the things that you saw, and then what message you could take on the road for other law enforcement officers that may be on the fence about it?
That's a big question. That's a
Well, I talk
really
a
big
lot.
question.
You know, I try to roll it out.
In the sense, I mean, you often hear me tell you that, law enforcement wasn't trained to let people go. Even most of our lives, we go through the academy, we're taught to lock folks up and then, let someone else deal with the aftermath of that situation. And so I know sometimes it can be very challenging for folks, because that's why I like the work that Jessica's doing, right, where she kind of brings something to the table, because oftentimes our budgets, or 99.9% of my budget was all in personnel. I didn't have funding for programming. I didn't have funding for even if I wanted to go down that road, it was just an early challenge of who can be able to support that work. And so I think it's often and so I think I tell people sometimes you have to have a multi-dimensional conversation. If you're trying to change minds, as I always tell people that people hate the way they think. Cops always hate the way things are, and they hate change. You can probably translate that off to a bit different, but particularly with cops, we hate the way things are and don't change it. And so oftentimes trying to expose us to that transformational process can take very laboring and take a long time. Oh, you can. But so I tell people that sometimes you come at the police department because it's much more efficient. Hey, listen, you don't have to take your men and women off the street. They don't have to go and sit for 5 hours in a cell block while they're processing the paperwork, and so you can just get them back out on the street quicker. Oh, some will come because they believe in their heart it's the right thing to do. You may get a police department that says, "Well, that's not a bad idea. I don't have to travel. My officer doesn't. I can continue to service the community in a positive way." Some come up because it's less paperwork. I don't have to do all of this paperwork. So man, cops hate doing paperwork, right? So they come to the space because they don't want to do paperwork. Some do it because it just, the paperwork is, as I indicated, and the cost savings that goes with that. Some of your municipalities are very stretched with their costs, and so reducing the cost of the processing costs. And so I think sometimes it is, yes, we want to find that champion in law enforcement, and I know sometimes that can be frustrating because you don't find that person who wants to take that leadership role. And so sometimes I think you have to hit it from all different facets. I remember sitting in an event one time, and I was in a place you would never think. I'm not going to say where it was, and it was a senator. I like diversion because it saves us money. That's what he was, a politician. He didn't care. And I said, if that's what's going to bring him to that space, then let's bring them along. And so I think for a law enforcement perspective, you kind of have to do a broad brush, not just kind of localizing it into it's just because that is the right place, right? I'm not going to say that, but oftentimes, for our culture to change, it takes decades for our culture to change. The paradigms have shifted in policing multiple times. So you could do a shift and it could take, I am 5 years into the process and still trying to shift the culture. And so, oftentimes you have to kind of use, the varieties of approaches and be not afraid to do that you're going to get to the same solution, but it may not be the way you want it to be, but it's an effective way to link your partnerships up with collaborators who want to get it done. I hope that makes sense. I don't know if I really answered your question, John. If I missed it, come back with a follow-up.
Yeah, I gave you a long question. Sorry, Kevin. I was trying to piece that together. One thing, though, that you're very inspiring when you talk about this. I've heard you say it. What changed for you? What was the decision point for you? What made you pivot for what you were doing, and then when you decided, okay, we got to change the process? How did you know?
Oh man, listen, I think I went through a laboring process, as 3 years of just being exposed to trauma training and de-escalation and adolescent development, and one was the data. When I looked down at the data and recognized that I was putting these number of young people into the system, and what a travesty it was, because at the end of the day, I was responsible for that and for those low-level offenses. But I often share, as a video with many when I do my presentations, and I do a presentation where I show a young lady being arrested for coming to school with a pair of scissors. At the end of that video, I share with the audience that child is my daughter. And I look and I said, I remember the time when I took her out on a Saturday morning to do this video because I wanted to show those who I was presenting to what is it like when you send them to me, and what does that mean when I put a child in custody. And looking at my daughter getting arrested would ultimately take me to a whole nother place, because I said, that's when you sit there and say it's okay when it was doing to somebody else's child. it's a hell of a lot different when you're doing it to yours. And so that would inspire me to say, you know what, when I look at this process, every time I see these kids, I say, would I want that to happen to my daughters? Absolutely not. And so that would ultimately push me to the brink of saying, you know, this is the space I need to be in. And then for me, I mean, I know that's not a lot of folks, you know, come to that place like that, but that was my space. And yeah, that's my story. I'm sticking by it. Yeah.
All right. Thanks, Kevin. So I want to shift gears again, and we received a couple questions and one or two statements, but Kevin, you had just mentioned it, and I think Bernard and Jessica, you had mentioned it too at some point, but with youth and families and the significant trauma histories that they bring when you first see them and they're walking into, you know, the building or the community that you're working in, what are some ways that you address either your staff or some of the services that you're providing around trauma in kids and families?
All right, so I have a trauma screen right here. So I believe assessment, am I on? Yeah. All right, so assessment is crucial. So we had all of our staff trained by the APA president, Dr. Alta Stewart. She's with the University of Tennessee Health Science Center. So she came in, trained all of our staff, even our community liaisons at the police precincts. That, you know, that is a strong indicator of our commitment from our leadership down. Our judge mentioned that he wanted a trauma responsive court system. And the only way to really make that happen is to know the problem. Therefore, we assess every parent, we assess every youth that come into our court system. In addition to that, going back to that resource directory and knowing that the people who provide trauma-based services in the community, not only doing the assessment, but making sure that they get the necessary services that they need. So trauma is at the top of our list for every family that we see, to make sure that we're assessing it, but not only assessing it, but making sure that they have the necessary services in the community. But that also indicates that a policy had to be changed in the way that we had to operate. You know, instead of, we used to do the YASI, the Youth Assessment Screening Instrument, but now we had to move over to this trauma screening. And then in addition to that, we're about to move into the CANS, which is a Child and Adolescent Needs and Strengths assessment that also has, that's statewide in the state of Tennessee that we're utilizing that instrument. And I believe Vanderbilt was an instrumental component with making sure that we had a cross-system data collection sharing system statewide with the Tennessee Commission on Children and Youth as well as involved in this process. But I believe you have to have a structured system to make sure that we're assessing people to understand the traumatic experiences that our families are enduring. And that could be the indicator of why they're acting out in the first place.
Okay.
Yeah, and I would add, same thing, we use assessments, and all of our staff are trained in trauma, motivational interviewing as well is huge for us to make sure that the family has a sense of a meaningful role and a sense of agency through the process and helping to form the service plan and have a real say in that. So I don't want to repeat what Dr. Williams already covered beautifully, so all of that. And what I would add is taking this back to the equity piece. Yes, we see a lot of families with dysfunction or mental health disorders or trauma or a combination, and substance abuse treatment or substance abuse needs. However, in our jurisdiction, where most of our arrests are of Black and brown youth, we also see a disproportionate amount of arrests for really minor issues that are not, the family might have trauma, but it's not really an indication that that kid is going to be, is really a danger to society or needs justice system involvement. So our kids don't need justice system involvement to get connected to services. So there's a few things going on there. One is making sure that you have protections around net widening and that you're not using the diversion entry point as the entry point to get needed services. So we're constantly working on upstreaming and making sure there's safety nets further upstream before the point of arrest to get kids and families screened and into services as needed. Because we see, for example, in our area, there's a county just south of us, Orange County, that is much wealthier. The demographics are different. In a lot of areas, it tends to be more white and Asian. And we see huge differences in who's arrested for what kinds of behaviors. So there's that piece of just making sure that minor instances aren't overly criminalized, particularly by our schools. Our schools tend to be the #1 entity that's calling police. And so working to make sure that schools have additional processes, alternate processes for responding to behavior in ways that are not criminalizing.
Okay. Thank you, Jessica. Kevin, were you about to say something?
No. I think they both covered that area pretty well.
Okay. Just looking at some of the questions, I know there was a specific question to Dr. Williams about the trauma screen being used, and I just want to make sure that gets out there. Dr. Williams, I'm not sure if that went to everyone. Can you give the name again by chance?
Yeah, the name of it is trauma screen is CPSS, and I believe it's, I can send that out. We can send that out to everyone, John, to ensure that they get it.
Okay.
John,
all right.
And John, there was a question I saw in the chat as well around, how the programs, I believe that the chat asked about, determining how the programs, I'm just kind of looking through.
Fidelity?
Yeah, fidelity. So one of the things, just for we engaged early in the process. I engaged a researcher. So for the time I started in 2014, I was able to engage Drexel University, Dr. Goldstein, to kind of really make sure that what we were doing was research, and that, because I had questions about whether the programs were administering, in the same way. So we've been evaluating that over the last 4 years. They all go through a process where they fill out some of the similar paperwork, because when they first went in, the different agencies were doing different types of paperwork that would made it very hard for them to kind of evaluate, what was it look like even when they came in the door. So they were able to create a model that all of the providers use the same entry paperwork. And then I'm not sure of the tool they use. I know they use some evidence-based tools beyond that to do further screening. But that was our way of kind of making sure, and soon hopefully have reports that'll come out to show, whether all the programs are working effectively, or whether there's some that do better than others, and then looking to see what are they doing that may be different. They have 7 core elements that they all deliver, but how they deliver them often still is relied on, obviously, the staff and how they do that. So we thought that was important, and that works for us.
Hey,
okay.
Hey, John, I'm going to get the name out. It's the Child PTSD Symptom Scale. The Child PTSD Symptom Scale, CPSS.
Okay. We could probably figure out a way to get that out to the group or post it somewhere.
Okay.
I'm sure Brian could help us do that. So, okay. Just looking at the time, I know we have a couple minutes left. Brian, do we have 10 more minutes, or does this goes to 2 o'clock, right? Correct, 2 o'clock Eastern. Okay. So I want to ask one more question, or maybe a couple more, on the data side. I know we all feel that data is important. And I know Kevin just touched on it in working with Drexel University and Dr. Goldstein. But Bernard and Jessica, did you find when everyone says, well, let's look at the data, did you have any challenges in doing that? Did you reach out to local universities? And then as far as the outcomes and some of the things that you shared, I know I'm not going to ask you to go back to look at the specifics that you shared last time, but were there others that, since we're talking about diversion, was there one particular outcome in the data in the data that you looked at or reviewed or had reviewed that was more important than others? And then the other question is, how do you make those relationships and who you reach out to in your jurisdictions? And then how do you find the resources to do it?
Yeah, first of all, when you start doing data collection and allow it to tell the story, we had an arrest report written on a 4-year-old for manufacture, deliver, sell marijuana. And once you start showing the police, that some of the behavior of the officers, some of the commanding staff almost passed out. Because, you know, when you start seeing a 6-year-old with an arrest report, a 7-year-old, 8-year-old, 9-year-old, all these kids coming into the system, and then our director asks the question, do we have to enter these kids into our juvenile court system? And there it is again. You start looking at the policies, as Kevin talked about, and the answer was no. And that was the birth of us making sure that we sent our staff, which means no money, no additional money. We sent 3 of our staff out in the community at the 3 precincts to help scale back a lot of those unnecessary reports being written. So they are placed at the police precinct, having the exact same role as they would have here at the court, but actually more intentional because they would have to be connected to the community at another level, of course, because they're already in that neighborhood with the kids. In addition to that, when the kids did have an arrest report and it was their first time, we developed a graduated response grid. And that is a decision-making tool to ensure that all of our cases were flowing in the same manner. And that way you would not have any racial and ethnic disparities, challenges with, the outcomes of cases. White youth have a favorable outcome, Black youth have a separate type of outcome. But with this graduated response tool, it allowed us to, do everything based upon the contact, and we would have these responses on the outside that would help guide the counselors with the decisions. You almost have to really do something really bad for us to file a petition on you now. Instead, in previous times, we could file a petition on anything and send you to court. But now we're looking for all of these innovative ways on the front end to ensure that kids aren't going deeper into the system. So this graduated response grid helps us to identify the problem with the trauma screening, but make the necessary referrals back into the community, but also to ensure that the kid doesn't have a record. As of to date, we just ran our November data, our Summers Review program. We have 9% recidivism rate at this point. So now we every month it's improving as we look at the data, and these kids do not have a record. And we're going on 2,000 youth, 1 year removed from 2018, and now we're looking at a 9% success rate. I believe that once you show the data in this way and communicate it with the community, it's hands down what we can do together as a community.
Jessica, I'm reading your body language.
We have a few things. We look at an important factor for us is client satisfaction too, not only both from the family, the youth and the family that we serve, as well as the crime victim or the harmed party. And that will tell us a lot if we're on track or not. And our kids have rated the process, 96% of our kids consistently rate the process as being fair and equitable. And 98% of the victims rate the process favorably. So if we're meeting the needs of both sides, that's really critical for us. We also look at recidivism, and we're also in about the 8% range, looking at 1 year out, about 8% of kids with a new arrest year after services. And with our higher risk youth, higher needs youth, they're at about 11% 1 year out. And that's been in a partnership with our probation department. They've been very kind and generous with us in helping to run that data, because as a community-based nonprofit, we don't have access to that. In a partnership with our court system several years ago, they helped pay for an independent evaluator to look at basically do a comparison group study of kids going through our program versus kids going through the normal justice process. And that was huge. They looked at 3 factors: recidivism, community service completion, and restitution payments. And so kids going through the restorative justice process with, and it was simply a one-time meeting with the harmed party and then our follow-up on the agreement. But at the time, our kids were not getting any case management, no other additional supports, only the restorative justice process. And the results were huge compared to kids going through the normal justice process of either informal probation or formal probation. Our kids were paying, completing their community service at 6 times the rate than if it had been probation ordered. And our restitution rates were 166 times higher. And that was basically because the court was ordering restitution payments, but there was very little follow through or collection. And in our process, the young person made a commitment to the victim in a completely different process. Nothing was ordered or demanded. So what was agreed upon was much more realistic and families would follow through. So those partnerships have been crucial. We've also worked closely by building trust with our law enforcement partners. They've opened up to us their arrest data so that we can look at who's being diverted and who's not and run comparisons based on race, gender, crime type to make sure that as many kids as should be diverted are getting diverted and that there's no disparities in that, or if there are, that we can talk about it and correct it. And that comes through trust building. We don't get that right out the gate with a new referring agency. We have to earn that trust. So those are some of the big things we've looked at.
Okay, thank you, Jessica. Definitely a lot of detail and important information. Great response, thank you. So last question, I think we have a minute, and I'm not sure, well, let me take a quick look. Do you have high fidelity wraparound in your communities? Do either of you want to take that on? Does anyone? No?
I can.
Okay.
Yeah, there are some agencies in our area that provide wraparound services and high fidelity wraparound. And so we partner with them with our highest needs families and make sure that whatever we're doing on the diversion end is not overwhelming the family further, and so that we can work together in a comprehensive way to make sure the family's getting what they need and not being over-serviced or overburdened, but still making sure there's a time and place to take care of the harm to the victim. And then beyond that, we work in a way that we do individualized service plans for each youth. So our lower risk, lower needs young people just meet with the victim or the harmed party to come to an agreement of a way to make things right directly, and they're done. That's it. That's all they do. Families with a little bit more needs, we might connect them to a service that they need. And then with our more high-risk, high-needs kids, we will go into intensive case management services. And so we work with the family over a period of 6 months and work through various issues, whether it's substance abuse, mental health connections, et cetera, until things have stabilized and are heading back on track. And we work to make sure that all of our families and youth are connected into long-range positive youth development programming. When we close out the diversion piece, we want to make sure that there's an ongoing relationship in the community with a resource that's helping the child build new skills and leadership and self-esteem and all of that so that they can be successful long-term. Thanks.
Okay, thank you so much, Jessica, for taking that last question. And I want to thank everyone for joining us today. I was just reminded by Brian that this session will be recorded and available on JDAI Connect. For those questions that we have not addressed, what our group will try and do is respond to those with the assistance of Brian Taylor after this call, and we hope to be in touch with those responses as quickly as we can. Otherwise, thank you to our panelists, Kevin, Bernard, and Jessica. We sincerely appreciate it, and happy holidays to all.